Hi there. I apologize. I was live a moment ago sharing this information about lab tests that I use to assess inflammation in the gut and tongue diagnosis. Reconnected, people will still be able to see, but we'll see how that goes. So we got to the part where we're talking about lipopolysaccharides and basically how they come from inside of the gut and outside and can cause inflammation. That's the endotoxemia. So another marker that can be used, and this is from a test that's called a urinary organic acids test, which again I run fewer of these days, but there's a marker called indican, and indican, this is a little bit nasty, but it's basically when we eat proteins. In particular, there's an amino acid called tryptophan, and if we've got a overgrowth of certain bacteria, it can actually putrefy this tryptophan in our gut. And then if you notice, I mentioned this is a urinary organic acids test. So basically we're eating a certain type of protein and our bacteria is not happy, our ecosystem's not happy. And so it's getting putrefied here, and then it's basically going to the liver and then down to the kidneys and being peed out. So if this is elevated, that's also a pretty good sign that you have leaky gut, that your gut's too permeable and that it can be causing you a problem. So those are the tests. So and I apologize again that the live stream got disjointed and it got disconnected, so I've reconnected. But essentially, the lab tests that I was routinely running with patients, one was a stool test, which it can be helpful. I run one once a year just as a checkup. It can give useful information. I just rely on it less in terms of needing them to know what to do. And when I guide patients and guide clients going through a program, it's not necessary in order to know how to get better. But that test will tell you if there are parasites. It'll tell you if there is inflammation in your gut. It'll tell you about things like secretory IgA, and if that's low, that's often an indication of leaky gut. But it also measures inflammation like calprotectin and occult blood, which is that if you have inflammation that's actually causing damage to the lining. So that's a useful test. Another one is a blood. This is one from Vibrant America that I run called a wheat zoomer. So it can show you antibodies to wheat and to different protein fractions there, but it also is going to show you antibodies to something called lipopolysaccharides, which that's kind of a slam dunk diagnosis for a gut that's too permeable. And then the last one is the urinary organic acids. But then I mentioned in my original post, which was, that you could just look at your tongue and see what that's telling you. And that's really, it's not going to tell you if you have leaky gut. It's not going to tell you if you have elevated calprotectin or lipopolysaccharides, but it is going to tell you about the ecology of your system, which I would say for most people is more important, often, especially when knowing what to do. So this is, part of in my program where I help people recover from complex chronic illness. There's a whole advanced module on how to read your tongue and know what to do. But essentially what we're looking for, one of the things we're looking for is it moist and coated and damp, or is it dry? And just keep this really simple. You don't have to be, a doctor of acupuncture to get meaningful information from this. And also, does it seem cold in the sense that it's pale and flabby, or is it hot like it's red? And then from there, you learn to see these signs. So if it's more cold, it's pale, and it's fat, then you're going to do things like warm it up. And if it's more hot and it's red, or has a yellow coat, then you're going to do things to cool it down. And if it's damp and it's coated and it's nasty, then you're going to try to break that up and push it out. And if it's dry, then you really need more kind of nourishment to your mucosa. So you need support for your stomach to be able to produce gastric secretions and mucus layer and enzymes from your pancreas and so on. So it can give you a lot of information. Now, if we hop back over here, right. So this is interesting. This is from a study on using a computer to make tongue diagnosis based on photos. And again, if you are not a practitioner and you're a member of the public, don't worry about any of these details. What I want to draw your attention to is if you look at this, let me use this here. If you look at this guy here, you don't you don't need a lab test to let you know if there's a digestive problem, because you can see the overgrowing biofilms from an unhappy digestive on the tongue, right? It's not meant to be thick and yellow like that, and it's not meant to be coming to the tip. Same here. Right. Someone, when I'm seeing tongues like that person usually has a lot of mental, emotional issues in addition to digestive issues, but not always. But you don't need a lab test. So, like this tongue here, it doesn't correspond to a specific lab finding, but you can go through a process to know exactly what to do next if you have a tongue like that. The same here. I mentioned that you can see if someone. This says like yin deficiency that is dry because you can see the cracks. It also has biofilms on it that don't want to be there. And then you can see if the tongue is thin, that it needs more fluids, and if it has tooth marks, that it's become fat. But it can be extremely empowering that whether or not you're a practitioner or just a member of the public wanting to improve your health, to know that you can see this whether or not you're running a lab test and make meaningful signs. Now, that said, it's if we go back to these findings, what I will tell you as a practitioner who looks at lots of tongues is that often there's more than one thing going on. And if you're a practitioner, you know this too. So, for example, that says yin deficiency. Well, yes, there are cracks, but there's also gunk. So what do we do, right? Or, here you can see that it's a thin coat, but you can see these like little dots on the end. You can see this gunk here. So most of these have multiple findings. This one says normal, but I would say that the color is normal, but it's a bit red here. This is a bit like stagnant on the sides. So my point is, it's like you still... whether you're using lab tests or you're using tongue diagnosis, you still need I find it helpful, and I've learned from very smart mentors who have learned from their mentors. It's what's really helpful, because most people, if you have any sort of complex chronic illness, you have different stuff going on, to go in a systematic order, in a systematic process. And so in the program, in our group, we use a 4-stage model that's really useful, whether you have autoimmune conditions or chronic fatigue or fibromyalgia or long haulers or mental, emotional, or functional digestive, in a way, because, what we started off by saying is that, you can have a leaky gut but have no digestive symptoms. Well, how are we supposed to navigate that? It can be really confusing. And so really going through a process, where kind of where you're starting, where you're going next, is just extremely valuable, because you're doing things in a proper order, in a physiologically sound order that your body likes, and it can help make sense. And you can use your tongue as like a way to course correct along the way. So in this 4-stage process for complex chronic illness, we start with the immune system. So we don't even, most natural medicine folks say everything, we should always start in the gut. But, if you have a chronic viral infection, you're not going to make very much progress on your gut until you take care of that, right? So we start with the immune, then we get into digestive, and we start using things to tackle that. But we really don't need lab testing to do that. So when we're looking at lab testing, if we're looking at part of the difference in this approach is looking at things systematically. So we have inputs, we've got processes, and we've got outputs. Okay. Now, if you are looking to become healthier, usually you're focusing on inputs, right? You're like, what supplement should I take? What herb should I take? What treatment should I do? What device should I use, right? We're focused on inputs. But then you end up in the scattergun approach. Like, well, where do you start? And you're going to use everything at once. What do you start with? So if we focus on processes, then we always know what to choose and what to do next. Now, where I was going with this is that in terms of outputs, the outputs is the result of the system. Lab results are outputs. Okay. So you want to go upstream and see what process is going on, and then change the inputs to go with that. So it's, if you treat to your outputs, you're already missing the boat. You want to go upstream. So if we come back up here, then if we're looking at lab testing, where it is useful is for tracking. Okay. So the example that I gave before, if we saw that the person had a heart attack and didn't have any other risk factors and their lipopolysaccharide antibodies were 400 something, then we're going to go through the systematic process, and then maybe in 6 months we can test to make sure that we're on the right track and just to confirm that those have come down. But we're not treating to those results. We're not trying to suppress those antibodies, right? That's how you get side effects, okay? Which is how other systems operate. So we do immune, then digestive, then neuroendocrine, and because we're a complex system, all of these systems interact with each other. So, of course, our brain and our nervous system is interacting with our digestive system. We have like a huge, brain at our digestive system. So, we want to make sure that we're kind of going in an appropriate order and being strategic so that we can improve things in the way that the body, understands. And then tissue healing, which is not always, something that everyone needs to do, but it's for things like if you have an untreated concussion, or if you had surgery, or you had an injury, often we're trying to, or neck instability, we're trying to fix these things before we've done the groundwork here, and we're not getting very far. But so for a digestive issue, maybe you have tissue adhesions, from either not breathing well, or from surgery, or from just things not moving well. So basically, that is how it's nice to know that the lab testing is there, but first of all, it can become expensive very quickly. And so the question is, where's the value? If someone has limited resources, I really want to make sure that they're prioritizing their nutrition and the strategic use of botanicals and other things, rather than the lab testing, which I will tell you, the most important part of lab testing is the retesting, right? Using it as a marker. So you can, you're going to make an investment in lab testing, but are you going to retest to see how things have changed, which is really what's needed. So they can be used pragmatically. I think it's helpful to know that they're there. I think it's helpful if someone like a practitioner is making a claim that something's going on, that you're able to understand exactly where they're coming from. So if I, for example, am saying to you, that a lot of people who don't have digestive symptoms have gut inflammation, that I'm able to back that up with specific data and explain where I'm coming from, rather than sort of just throw it out there as some sort of remark. So it can be helpful there, and it can be helpful, I think, to draw focus. So if you've been ill for any length of time, and you've tried different things and things can get confusing and you don't know if you're getting better and you don't know where you should focus, then sometimes having a lab test and having it in black and white can be very validating. If you've been told that there's nothing wrong, that you can see that there is an issue. Like that patient was told that he had no risk factors for cardiovascular disease, but in my book, based on a shit ton of literature, that's a very high potent risk factor for cardiovascular disease. So being able to find that and see it is a useful thing. And then, using it to, I think, be proactive for preventing future issues. So I have, for example, someone on my program who does not have serious health challenges now, but her mother has Parkinson's disease and is currently declining and having issues. And this person, I was starting to see that she has very small niggly things that aren't bothering her that much, but it's exactly what her mother had at her age, right? And so if you don't have severe symptoms and you want to be proactive, then using lab testing can be very useful, because it can provide raw data for risk factors like, the anti-LPS antibodies, that where there's no digestive problems, and then you can address those and see them go down even if you were not highly symptomatic. So that's another way to do it. So I'm just going to take a look at if there's any comments. Brody says, "You're so generous with your information. Thanks so much." Well, you're very welcome. So I think that is that. Now, if you are a person, I bet you are a person if you're watching this and understanding what I'm saying, but if you're a person who either has a complex chronic health issue and you want a systematic approach to achieve medical independence and to make progress and to kind of know what you're doing going forward, then I would encourage you to apply for our group over at Synthesis Health Lab. It is free to apply and join as a guest, and as a guest you get get access to like 50 odd and counting lectures and resources of things where I answer questions and I share frameworks. You can also ask me any questions there, and you are in the group with annual members and people going through the program, so you can see what that's like in real life. If you are a practitioner, then I'll say two things. One is, if you are, a lot of the people in the group who are going through their own health transformation are practitioners, because a lot of times our own health challenges bring us to this medicine. So you're very welcome if you are wanting to improve your health, to come as that. Now, if you are a practitioner who is looking for training, the Synthesis Health Lab is currently not a practitioner training environment. I do have a kind of a sign-up form where you can express your interest. I should have some educational things coming out in the next year, and that you can be notified when that's available if you're interested. But just know that if you apply for the group, there is a question that asks, are you here for your own health, or are you here for your patients? And if you say that you're here for your patients, you're not going to be allowed in the group. But if you say if you're here for your health, then there's a very good chance, if you're a good fit for the group, you will be. And what happens a lot, I address this a lot, and I've written articles on it, but it was a really big insight that I had in my own healing journey, which is this: that if you are a practitioner who also has health issues, what can happen is that you go from training to training, and in your mind, you are feeding two birds with one stone. So you're like, I'm going to learn this other technique, and I can add, as someone said, I can add another string to my bow, and I'm going to help myself by learning this technique, and I can help my patients, and it's a tax write-off. So I'm doing two things at once. And I really want to share that I'm wondering if doing that dual frame where you're like, I'm going to learn for my patients and for myself, is actually keeping you sick. And that was something that I did for a very long time, that I was struggling with my health, and I did certification after certification after certification after certification. And what I can tell you is that the steps that are required to go through in order to transform yourself and improve your health, there aren't any steps in common with training to be a practitioner of something. So I want to encourage you that if you are in that role, that you think to yourself, you know what, rather than think, I'm going to come into the Synthesis Health Lab and maybe it'll help me, but also it'll help my patients, I want to encourage you to kind of set aside that second part for a moment, because nothing's going to help your patients more than you being really healthy. Okay? And once you get there, then you can decide how you want to help your patients, right? But I encourage you to separate the two. I want to train in this thing so that I can become healthy and help my patients at the same time, and to just narrow it down to say, this is me taking care of my shit and getting healthy, and going through a systematic process of creating health from the inside, and like working on the mental garbage and all of those things I need to do. And we're going to leave the professional stuff over here for now. We're not going to do two things at once. We're not going to multitask. We're going to leave that over here for now. So this is something that it took me a long time to realize that. And once I realized that, I was able to vastly improve my health, which of course helps me help my patients, right? And of course I can use what I learned to help my patients, but it's a separate thing, right? So I hope that's a helpful distinction. So thanks for joining. Sorry for our technical glitches, and I'll look forward to seeing you in the lab. Take care. Bye.